He's just sort of had a thickening on the tip of his nose, and it's sort of just piled up there. It just looks like he chewed a whole pack of bubble gum and just slapped it on his nose. And now we just want to take that off.
My name is Henner. I'm from the Philippines. I'm 39 years old. I had this problem with my nose since 2004. This is how I live my life. I wear this mask to prevent people from looking at me.
So at first glance, it appears that Henner has got Rhinophyma. Rhinophyma is a condition where the nose actually grows. It gets thicker by overgrowth of skin as well as sebaceous glands, or the oil-producing components of the skin. It is often connected with rosacea, related to rosacea.
It started as a pimple. It produces bad odor. It feels heavy. It really hurts me a lot, especially when I touch my nose. Even if I move my face and it's shaking, while it's shaking, it's painful.
This definitely looks like a severe case of Rhinophyma. Now, Rhinophyma has traditionally been thought of as being related to alcoholism. If you've ever seen cartoons or drawings from, let's say, the 30s and the 40s, there are these drawings where you have drunks, people at a bar with these big round noses. So erroneously, people thought it was related to alcoholism. Well, alcohol can play a part of it, but it's not the main cause of this. It actually is related to rosacea, which is this kind of chronic flushing that some people get of their skin, usually caused by triggers. Triggers like, for some people, hot drinks like coffee or tea. For other people, wine can do it. And for others, something as simple as exercising can cause rosacea to flare.
Every time I go to a public place, people are laughing at me or talking at me. I feel embarrassed and outcast. I don't like to be treated this way.
What is wrong with people? This guy's got a true medical condition and people are making fun of him?
Hi, I'm Sandra, Dr.
Nice
Lee.
to meet you, Doc.
Nice to meet you. Welcome. How long have you had this for?
I believe it started last 2004.
14 years ago or so.
First, I thought it was just an ordinary pimple.
And it just kept coming, huh?
Yeah.
Do you feel like it's still growing or it's kind of stayed about the same?
Yes, it keeps on growing.
His is a little bit of a different presentation from what I can tell. Usually it starts kind of small, and in people who have very mild Rhinophyma, that once again is related to rosacea, you can oftentimes treat it very simply by doing things like Retin-A or tretinoin. Sometimes using metronidazole, which is an antibiotic, can help with that. And some people are even put on Accutane or isotretinoin, a prescription, to help reduce kind of that overstimulation of those sebaceous glands. And that can help people who have mild Rhinophyma. His situation, however, is way beyond that, and the only real solution is surgery.
You know what this is called?
No.
Rhinophyma.
Rhinophyma?
Yeah. Rhinophyma is like a thickening of the skin, in particular on the nose. It's actually an extreme form of rosacea.
Usually Rhinophyma creates more of a round, bulbous tip of the nose, not one like his that's just kind of all almost warty type looking.
Henner has really an interesting presentation of Rhinophyma. He's just sort of had a thickening on the tip of his nose, and it's sort of just piled up there. It just looks like he chewed a whole pack of bubble gum and just slapped it on his nose. And now we just want to take that off.
So when you look closely at him, he's got this big mass on the tip of his nose, which is not what you usually see with Rhinophyma. But the good thing, as a surgeon, oh, how nice and how satisfying it would be just to take a scalpel and lop that baby off. It would be absolutely beautiful.
I've done quite a few of these where we remove the Rhinophyma, and that entails using like a hot wire loop to like re-sculpt your nose.
So how do you get rid of a rhinophymatous nose like this? Well, if it's not really bad, you can use a laser, like a CO2 laser, and just gradually burn it down and burn it off little by little by little. But that can be very slow, very tedious, and take a long time. she's mentioning a wire loop cautery, where essentially it's cautery where you're burning the tissue, but it's this little wire loop that you can run along the tissue as kind of like, like a cheese slicer type of a thing. Like you've got those wire cheese slicers where you cut through it and take off piece by piece by piece.
So one little baby pinch here, okay? Just a pinch on the side. I'm sorry. Oh. This is a tough case because it's taking me a little longer than I expect to numb this area.
This is where, as a board-certified plastic surgeon, I would treat him a bit differently than Dr. Lee. Instead of doing this under a local anesthetic in the office, I'd bring him to the operating room, I get him asleep, I take a scalpel and lop that baby right off. It would be so, so satisfying. Well, Dr. Lee is a dermatologist. She's doing this at her office under a local anesthesia. The benefit of that is that he doesn't have to, be delayed to have to do all the paperwork and the prep work, and he doesn't have to be subjected to all the chemicals that you get subjected to when you're having anesthesia.
This tool has an electric current that goes through it, and this current allows the wire to heat up so you can cut through tissue very quickly. We use a vacuum to help suck up any of the smoke that's created from burning inner skin. We want to remove the smell of burnt skin and also protect all of us in the room from inhaling a skin.
So why is it important to suck all that plume, that smoke up? Well, two main reasons. The first reason is that there are studies that show that if you inhale a lot of that bovie plume, meaning that smoke from burning flesh, you can actually be at an increased risk of cancer from it. And the second thing, and almost as bad, and actually much scarier, is that when you burn tissue, sometimes viruses in that tissue can survive theoretically. Then you can breathe that into your nose and into your lungs and the back of your throat. So imagine if you've got a patient who, let's say, has genital warts, and you're burning those genital warts off, and you burn it off and you breathe that genital wart smoke into your nose and the back of your throat. Theoretically, you could grow a patch of genital warts in your nose and your back of the throat from that. Ugh, that is frightening.
I feel like it's the closest I get to being a sculptor. I've got to unearth this nose and the rounds and the curves of the nose without taking off too much, because once you remove too much, you can't put it back.
That is so true. The main concern with this procedure is if you're over-aggressive and you cut too much of that skin off, you may not have enough skin to cover the cartilage of the nose. And then the only option you have is to put a skin graft or even move skin from the forehead down to actually cover that nose. So the fact that she is doing it in this kind of small amount at a time fashion means that she's being very cautious and is being a really good surgeon.
Rhinophyma surgery looks maybe a little bit brutal. It's actually kind of fun, especially when you come across these pockets of sebum or oil. Look at this oil here.
So when you cut through a nose that has severe rhinophyma like his, it's not like you're just cutting through like rubbery skin or tissue. You're cutting through these little patches and these little cystic type structures that are filled with oil. So you cut through it and all of a sudden you have this oil that just oozes out at you, or sometimes if it's under high pressure it can even spit out a little bit. And some people may find that satisfying, other people may find it absolutely disgusting.
It's like you're eating salted caramel vanilla ice cream that has little chocolate covered squares of caramel in it. And you're taking scoops away and you never know when you're gonna hit one gem of a square of caramel. That's exactly what it's like. That is extremely satisfying, I guess in a sick derm way, you know?
A lot of things that we find in surgery we attribute to food. And there are a lot of medical conditions as well that we compare to food because sometimes that's the only way to really describe some of these things. And interestingly enough, I've been in the operating room where I've been, elbow deep in a person's guts doing, big surgeries and stuff. And what do we talk about in the OR? We talk about food all the time.
I think we're done. Let's take a look. Turn that off again for me for a moment.
I feel like the snake shedding for a new skin. I feel much better.
It's okay.
Yeah, okay. Much better than before.
Yeah, and it's going to be better than this too. How long has it been? Almost 15 years.
Yeah. Not only the skin will heal, my heart will feel
That's the most important.
When I look at the mirror for the first time, I'm very much happy. And to that person in the mirror, I would say, we have already won. We have already overcome this problem.
Dr. Lee did a fantastic job for Henner. Believe it or not, his nose can continue to grow if he doesn't control this. So avoiding those triggers, whatever his triggers may be, will help it. Possibly putting him on a course of Accutane or isotretinoin, that can help reduce the activity of those sebaceous glands as well to help prevent his nose from regrowing. We don't want a Pinocchio type situation here. Not only is Dr. Lee an expert at removing these masses from the ends of noses, but she's also an expert at removing huge fatty growths from the back of the neck on patients as well. And if you thought this was interesting, take a look at this video right up here where she takes this huge lipoma off a person's neck and I react to it.